Just wanted to make sure everyone can hear me correctly and see my screen.
Yes.
No problem.
Awesome. So it is, at the end of the day, the purpose of these talks are very simple: to able to communicate the emerging technologies in a way that it inspires you, it sparks an interest in you to further pursue your related fields. Doesn't have to be stroke, it doesn't have to be Alzheimer's, it doesn't have to be dementia. I mean, it has to be neuroscience, because let's face it, it's the future. But at the end of the day, the idea here is that you are inspired to understand the emerging technologies of the current status and what is the future outlook of these technologies in the future. And one of them is artificial intelligence. I have been in neuro ICU and stroke, and I mean, to be honest with you, I'm an epileptologist too. But the idea is that one of the few things that we are trying to achieve here is using these technologies in a more clinical fashion. That does not mean that basic neurosciences is not the key. As a matter of fact, we rely more and more towards basic neurosciences to give us the clinical tools we need to affect patient change. So that's why I really wanted to go ahead and start with what the role of artificial intelligence in telestroke. So artificial intelligence is one paradigm shift, and then telestroke is another paradigm shift. So literally, it's a story of paradigm shifts and a story of convergence. Those are the two things that I think are extremely important to understand. It is literally convergence of two paradigm shifts. What are the two paradigm shifts? One is the paradigm shift in care delivery, which is the virtual care, the telehealth, the telemedicine, whatever the word you want to use. I use the word virtual care. It's more colloquially telehealth. It's just easier to understand. And the second most important thing is artificial intelligence. What are we talking about in terms of paradigm shift? Is care prediction. We want to move from care delivery to care prediction so that we can prevent future problems. And that's where the key term of artificial intelligence comes into play. Now let's talk about first these mega trends, and then I'm going to come to the topic at hand with clinical examples. The most important trend that has been going on is neurosciences. People say, well, what do you mean by that? Well, let me simply say this. The 19th century was the cardiology century. The 20th century is the neurosciences century. People were dying from heart attacks at the age of 30 and 40, and we are preventing them. So cardiologists were great enough to actually save these people from heart attacks, and they're living longer to live with what? Stroke, dementia, Parkinson's disease. We literally now have larger and larger populations around the world that are living with neurological problems. Then we're going to move toward digitization and virtualization, how data, compute, and bandwidth is changing, and analytics and intelligence. I talk a little fast. I'm going to take maybe 30 minutes. And if you have something, please raise your hand and then ask me a question in between. I'm fine with it. So let's start. When I say what is the neurosciences, is the important thing, what is the proof of that? Here's the proof, by the way. In 2013, Obama officially proposed the Brain Institute and the Brain Initiative. He allocated around 500 million. It's 434 was the initial announcement, but overall money that was dedicated towards Brain Initiative was $500 million. And by the way, do you know what happened? Within 2 days, that $500 million was matched by private funding. And private funding in terms of non-NGO, non-governmental funding, in terms of basically research funding by different institutes around the globe. Literally the starting was $1 billion. This has been going on for a while, right? 2013 is actually a little delay. Since 2000, we have seen that people have been living more and more with neurological problems. People have understood that the next century belongs to the brain, not just the heart, the kidneys, and everything. Because we can get a kidney transplant, right? We can get a heart transplant. My wife would love it if we can get a brain transplant, and she will tell me, Junaid, let's get in line right away. You need a brain transplant right away. So what I'm saying is that we cannot get a brain transplant. And that's one of the key issues that we have to understand, why neurosciences, the field that you guys have chosen, is the perfect field, and it's going to be active and important as a funding source for the next 50 to 60 years, no doubt about it. So kudos of choosing the right interest field at the moment. And that's another thing that you have to understand. The average life expectancy has been improving as we move along. In 1960s, this was 52 years. Globally, now we're looking at a life expectancy of 78 to 83 years. That is huge. I mean, there was a time that people didn't used to live above 30 years. That was before 20th century. More than 30 years was like amazing. And now we are seeing relatively, even in Pakistan, the life expectancy is moving forward from when I was actually in medical school, that was expected to be 63. I think now in Pakistan is 73 years. So we are seeing average life expectancy going further and further. And therefore, again, even in countries where we did not think that there will be a dual burden of disease. Remember, we always talk about communicable diseases and non-communicable diseases. Communicable diseases are getting better and better in terms of management, even in low-income countries, because of availability of antibiotics, acute care, etc. And now we are seeing a significant burden increasing of non-communicable diseases, diabetes, hypertension, etc. And we are seeing that shift. And of course, oncology, unfortunately as well, is growing at a pace that we are seeing neuro-oncology as one of those things, because we now also can diagnose them in low-income countries as well. And we have seen a lot of different technologies that are coming into the market. And there are literally every single stack of technology is producing a different level of impact. I mean, if you look at material sciences and components, we're actually having microscale electronics. We have transparent materials that are able to transverse. We actually look at nanotechnology. We actually have optical probes already. We have miniaturized microscopes. When we're looking at the neuroscience methods and methodology is concerned, we have better electrophysiology tools, we have optogenetics, we have better biosensing technology, and all these amalgamation, these convergence, again, the key word over here is convergence of different technologies will create. Unfortunately, I still believe that we are literally at the infancy of neuroscience's breakthroughs. And why do I see that? I mean, seriously, like let's face it. What do we have to show here at the end of the day? What literally 22 years, if you look at it, 2022, how many medications do we have developed for Alzheimer's? I mean, literally, Aricept and Namenda is garbage. We only had one aducanumab that was last year that was approved by FDA. One drug, for God's sakes. And that one medication has been fraught with significant controversies. As a matter of fact, 2 people resigned FDA board because they thought that the drug was never good enough to come to the market. Why is that? And we'll come to that in a minute when we talk about further in terms of why we need to revamp and why neuroscience is going to become increasingly more important as you move forward in the decades forward. So number one is neurosciences is truly the mega trend that everyone is looking at. As a matter of fact, if you look at just the commercial applications, if you look at neurology, psychiatry, which I believe are both, which is mental disorders as well, combination of them has getting the highest funding in terms of digital health. I'm sorry, I forgot to put that graph in, but if you look at digital health funding as one place, you're going to see a significant amount of funding from venture capital in the United States is going on to these 2 areas as compared to not before. What is the goal here? Why did this fail? Why are we having a problem? Here's the problem. The brain does not regenerate fast enough. It's not a liver, it's not a heart, it's not a kidney. It does not regenerate. If you actually have dead neurons, they're dead neurons. You do not regenerate them into a liver cells. What do we need to do? We need to early detect them. So therefore, any medication that we try to target it, unfortunately, by the time we actually have been able to target that, the damage is already done. So why the hell will that make a difference? Period, right? I mean, if the damage is done on a cell that cannot regenerate, you cannot get an impact. So we have to go back. We have to go to early detection. And that's where the key issue comes in. And that's where the digital health, the 4 Ps of digital health comes in. The tenets, the 4 Ps in digital health, which encompasses both the virtual care, telehealth, and the artificial intelligence, is that we have to go from basically, responsive medicine to preventative medicine, to predictive medicine. We have to move the needle to go back in time and be able to do it early. For example, I develop a mobile application. Let me give you a real world example. Altoida is a new company that actually developed artificial intelligence based early detection of Alzheimer's disorder, raised $20 million in the last 3 days, $20 million in funding in the last 3 days for a mobile app that actually, when you are doing a 10-minute assessment on a regular basis, it will actually be able to predict that you are going to develop Alzheimer's in the next 5 to 10 years. Today, this is not magic. This is not, information that I'm coming out of my, future or anything like that. This is today that they have the app in system right now. Unfortunately, again, there are going to be a few things that I'm going to forget telling you, but during, and I'll put that in, the next slides or something for the reference to them. The other big thing is that change is change. And what do you mean by that? That when change is change? I mean, let's face it, change has been changing for a while, right? I mean, 1922 was exactly when Lama Iqbal got the title of Sir. And zamane ke andaz badle gaye, naya raag hai, saaz badle gaye. I mean, that was his line, right? I mean, that's true. And believe it or not, that's been going on for a while. Every single decade has brought more change and more geometrical change. That was true, right? Every single decade has a faster change from the last decade. But what's the difference about this? What's the difference when you mix in the artificial intelligence? Here's the difference. The change you do with artificial intelligence is not just algorithmic. It's not just, logarithmic. It's not geometric. It's algorithmic. So for example, if YouTube changes its platform, algorithm, you know how many people gets affected with one change? 2.6 billion. TikTok, 3 billion. Facebook, 3.5 billion. We're not talking about millions over here. We're not talking about even thousands or hundreds of thousands. We're talking about billions. We're talking about half a population of Earth, for God's sakes. That is the power of algorithmic change. So we are actually seeing that the change itself can be so fast, so disruptive, so deceptive, because people will not even think, oh, well, this is going on, forget, and boom, it's done. We are changed the change itself. It's like the Kodak moment. If anyone thinks that, oh, this is not going to change, I agree. We haven't shown any research in 22 years why it's going to change, right? I mean, what are you talking about? This is all bullshit. But that's the key thing to understand. When you develop the change, when there's a breakthrough that comes in, there's no lag. There's zero lag in implementation of that. There is no further problem in getting that out globally that it used to be. Now everyone has access to all these information for free, by the way, as this information is going to be free on YouTube too, right? So therefore, we're saying that the change has literally gone from logarithmic to algorithmic, and it has huge, massive impact. Now let's talk about the paradigm shift in care delivery. Now, care delivery has always been an issue. We always have issue of equity and access. What do you mean by access? Access means that a person who has access to medical care has been an issue, right? Especially both in low-income countries and even in in American countries. As a matter of fact, I am currently in Arkansas providing care to a facility flying from Dallas. So this is a hotel room. And the reason I have to do this is because there is literally lack of neurointensivists here. So therefore, I have to go in and provide care because they don't have one. So there's always going to be access issues everywhere. What they're trying to do, at certain places is that they're actually changing the whole paradigm shift, is that literally when I'm actually on my day job is I am taking care of 3 different neuro ICUs virtually. So I am at the website, WEB website, and then there is another person at the bedside. It could be a nurse or nurse practitioner, and sometimes I help with another physician. And we are now taking care of that patient. What difference does it make? Literally, now the access to a subspecialist was not there. It is now present. It is geographically redistributed. My partners are living in 3 different time zones, providing the care to the same facility. and eventually when you're going to see globally, this trend is going forward. As a matter of fact, we are looking at Dubai as an extension. Wow. I mean, I would have never thought that, I would come from Pakistan to America and now provide care in Dubai. Just mind blowing, to be honest with you. So this actual virtualization is not just change in care. It is literally a paradigm shift in care delivery. And when you have that paradigm shift, it produces different objects. And this is NIH from UK, officially 2030, vision of 2030 by NIH. From UK, they have officially said that virtual care is going to be our most important concern by 2030, and we're going to move that needle towards virtual care a lot. And of course, you guys are a little younger, but you have to understand, by the way, that you always see where the money goes. And because if you're going to see where the money goes, you're going to understand the real trends, by the way. And this is where the largest Fortune 500 companies are moving towards. I mean, Amazon Care, Walmart Health, they are both doing virtual care. And the reason they have invested in this massive amount of virtual care is why. The reason they have done that is because they see that to be the future of healthcare delivery. Again, there's a difference between delivery and there's a difference between healthcare itself. So the delivery model is changing. And this will, again, why is it again more important? Remember, this is very important where the money goes. I mean, I never realized that JazzPay and Easy Paisa will be the core form of digital transaction in Pakistan. That's a reality in Pakistan. I mean, I was brought up as a Mayman. I mean, we used to count money like crazy. I used to be in Sadr Electronics, and I used to sell, air conditions and fridges from my dad's shop in, all the areas in Karachi. And I mean, we never thought, we barely banked, to be honest with you, let alone have a digital banking system, let alone having transfer of data over money over your cell phones. So when your core infrastructure, as important as money, is gone digital, is gone virtualized, why not health? So there are people who will always say, well, we need touch points. Yes, we do. Nobody's saying that we will not have physical touch points to take care of patients, but we're going to see increasing massive amount of virtualization in every aspect of your daily life, which is the core two important things are always money and health. And money is always there, already there, in my opinion, and then it's coming to the healthcare. Now, this brings us to a massive another importance of that. As more and more care is being virtualized, and as more and more human beings are digitized and virtualized, we are seeing a massive amount of data that is now available, both in terms of healthcare data, disease data, etc. We are data machines. We are taking more digital pictures. We have, Apple Watches. We have ECGs. We have pulse oximetries. We have GPS locations. Literally, we are data machines, and we are creating data at a massive level. Just to give you an example, now we actually have data that your activity, your level of activity depends on your neurocognitive decline. There are studies, multiple studies now. Your retina scans can actually predict that you're going to develop Alzheimer's or not. These are data points that we never heard of. As a matter of fact, there's going to be another talk on digital biomarkers anytime soon on my YouTube channel, to make sure to understand what new digital endpoints are and what digital biomarkers are in terms of moving forward this technology. So we're seeing a lot of new data being formed, and this data is also coming from the virtualization, right? Because we are truly virtualized, then we are creating more digital data. As a matter of fact, now we are doing a study of stroke patients that they're going to have automated detection of dysarthria because they're speaking to me on video. We never had that option. Why? Because I wasn't holding a Sony ka Walkman लेके तो नहीं घूम रहा था, मैं record कर रहा था, फिर वो जाके मैं getting analyzed by artificial intelligence. I'm already digitized. The whole thing can be recorded right away. And once that is recorded, once the data is available, then only I can pursue data analysis in a way that it can make a function. sort of one of my key slides that I love showing, the healthcare data is not only cursed with velocity and volume, because we have a lot of volume that comes from disease data, health data, claims data, research, registries, biobank, etc. But more importantly, we have the curse of dimensionality because of time. Look, my metabolomics were very different when I was 20 years old and when I'm 40 years old. Huge difference. So over time, there's also a change that we have to account for. So therefore, the data is not only, unfortunately, not just a little static thing, but it's also constantly changing in terms of true, dimensionality of it. I mean, the dollar remains the dollar. I mean, you can go from 20 to 400, but literally Junaid itself changes when he was age 20 and age 40. Do you understand the difference? So therefore, the dimensionality of healthcare is very different from other forms of, data generations. I mean, YouTube generates data, TikTok generates data, Twitter generates data, but the dimensionality of healthcare data is very significant because literally the body is different every 10 years. So therefore, that is a key massive issue in healthcare to deal with. And therefore, artificial intelligence is extremely important. You cannot generate this amount of data and information and then make wisdom out of it. That's what we are trying to do. We are going from knowledge. So basically, let's understand the information continuum. Information is structured knowledge goes into data, which is structured. Then structured knowledge structured information data turns into knowledge. And knowledge that is actually actionable is wisdom. That's what we call the continuum. We want to get to actionable knowledge, which is wisdom, either to predict, prevent, care better, whatever that case may be. To get to that wisdom level, to get to that actionable knowledge level, we have to use artificial intelligence because there's so much data and there's so much diversity of data and there's so much dimensionality to data that we cannot do it without real-time churning of that data from different sources to make sense out of it. And as you can see, we are not actually adding more and more forms of data because more and more forms of biosensors are available. Genomics is getting cheaper and cheaper. So we're adding genomics data. We're getting new forms of digital therapeutics. Did you know that the FDA just approved two things? FDA approved artificial intelligence, the virtual reality goggles for pain management. It is true, it's FDA approved. This is not like, again, we're not talking about video games in future. An FDA approved therapy for pain on virtual reality. ADHD game. Now ADHD is being treated by virtual reality. Not only now this is a source of digital therapeutics as a source for treating patients, but this now also becomes what? A source of new form of data. So therefore, we are more and more as we are getting into into digital therapeutics, digital biomarkers, digital genomics. Every new technology that is coming forward is also producing more massive amounts of data. So this is an ongoing process that we are facing in terms of that is concerned. And therefore, artificial intelligence as a whole has to be thought of as a technology enabler rather than a technology itself. It is what we call general purpose technology. As a matter of fact, artificial intelligence is now compared to electricity. It is not compared to, I suppose, computers and silicon chips. Why? Because computers and silicon chips are actually one form of technology. However, electricity basically is considered general purpose technology, which enables different technologies. So it enables energy storage, robotics, genomics, blockchains, everything. So artificial intelligence becomes at the core of everything we do in the future. And it will produce a massive amount of economic growth as well. What is the key difference here? The key change is that to understand what artificial intelligence is, that we used to do human coding. We used to give a set of instructions to the computer, X equal to Y, then Y, and then Y equal to Z, Z equal to 20, and then A equal to B, and then these are like 300 instructions. And once these 300 instructions are gone, then we will tell it to the computer, and the computer will basically get these instructions out. We have changed that paradigm. We don't give that anymore. Now we give examples to the computer. Hey, these are a million pictures of cats and these are a million pictures of dogs. By the way, figure it out which one is cat and dog on your own. And now once you have figured it out, here's 10,000 and tell me which one is a cat and a dog. I didn't tell them that what is a fur, what is the eye color of a cat. I didn't tell them any other instruction. I told the computer examples. And by the way, that's why we call it intelligence, because that correlates with the human intelligence as well. So the complete paradigm shift in artificial intelligence is this. We have moved from instructions to examples. We have moved from human who's doing the coding, the programming, to data. We have given, that's what examples is, data is now programming and coding. So that's where the paradigm shift is. Now there are basically three big fields: computer vision, predictive analytics, and language processing, that goes as far as basics of artificial intelligence is concerned. In computer vision, we're talking about image analysis and video analysis. And I have so many good examples, especially in neurology. There's fantastic work being done. Let me give you one. We are doing a Connect-like camera, which is a depth sensing camera, which does a walk analysis of multiple sclerosis patients. Again, there are two new drugs that are being developed to improve walking for multiple sclerosis. This will be used as a new data and digital endpoint to analyze that medication's performance. We never had that level of objective data to actually say that, wow, this medication works. We are really entering a new plethora of neurosciences that we have never seen before. Again, these are some of these other things. And by the way, if you're going to go to my YouTube channel, some of these things have been discussed in different lectures as well. Now, I talked about artificial intelligence in neurology and why is it important. So I'm going to take two more things. One is neurology. Again, as I told you, that when the brain dies, we can't regrow it. And therefore, there's acute neurology, acute intracerebral hemorrhages, acute strokes, etc., where the faster we get to the patient, the better outcomes we can produce. So therefore, in acute neurology, the most important thing of deploying artificial intelligence is reducing latency of care, which is time is brain. So how do we do that? I'm just going to skip through a couple of slides because, it's important. Anyways, the time is brain, because if with 1 minute delay, you lose 1.9 million neurons, 14 billion synapses, 7.5 million myelinated fibers. As a matter of fact, in some fast progressive large vessel occlusions, you can lose a limb, a whole limb, in 5 minutes. So therefore, the minute you can reduce latency, the better it is for the patient. So how do we do that? We automate. Okay, what do we mean by automation? We automate because, we use artificial intelligence tools to automate the whole process. As a matter of fact, we have seen that when we add automation, we have decreased the workflow by 66 minutes. And we have 4 different aspects in which we move in stroke care. First is automated intracerebral hemorrhage detection. The second is aspects detection. The third is large vessel occlusion detection. And the fourth is CT or CT perfusion or penumbra dissection. Again, this automation was achieved through artificial intelligence. And the reason we are doing this automation is because we want to reduce the latency. So let's talk about automated ICH detection. This is actually a very low hanging fruit, and I don't understand why it was not done in Pakistan. So I'm doing it, by the way. So you're going to see within the next 45 days, a study coming out with some data sets. Some of the data sets will be included from Pakistan as well. These people literally used how many cases? 904 cases, 1,000 scans, literally. And they actually got a sensitivity and specificity of 98 and 95% to predict if the patient has intracerebral hemorrhage. 1,000 scans. And by the way, if you do it on Google Cloud, I mean, these are literally open access codes and open access stuff that is now available. So you can easily do that now. The reason that I say that is just of all the things we do, I mean, everything has, a sensitivity and specificity, and you have to look at pre-test probabilities and etc. But what you see is that at least intracerebral hemorrhage detection is freaking easy. It is actually one of the best ways to actually deploy artificial intelligence and test it, because this is so commonly done now here in the United States. As a matter of fact, we're thinking that some of the future CAT scanners will have built-in, because really this is considered now the standard of care, and this is so good in terms of detection that there's no confusion left that it is better than humans. And then not only it can detect, it can classify what kind of cerebral hemorrhage it is. It is subarachnoid hemorrhage, intraventricular hemorrhage, etc. And then there are massive amounts of commercially available applications in this space already. AI Doc, Viz AI, Rapid AI, etc., who can detect this as far as that is concerned. So the most important thing to understand is that find the right problem, because that's clearly when you are looking at your future thesis, you have to find the right problem in two ways, because you have to understand that you can commercialize that problem as well. So therefore, convergence, again, you have to learn in collaboration. We'll talk about that more. And then secondly, find the right problem, because even if you're not going to think of monetization pathway and you're a great altruistic person, that is great. But at the end of the day, the way you should look into that is somebody going to buy it? Because that's very important when you're designing, when you're looking at a problem. And once you look at the right problem, like reducing latency in acute neurology is extremely important. So that's one of the things that I wanted to communicate when you're looking at different aspects of it. Now, this is the actual paper that I wrote, Role of Artificial Intelligence in Telestroke. This is open access, so people can actually view it. I actually made an animation out of it, so I'm going to get into that in a minute. But before I go into that, now let's look at chronic care in neurology. Look, we talked about acute care. Why was that important? It was important because reduced reckoning. Chronic care, I talked about it because we need new biomarkers, because we need to go to early detection. Now, we are already working on serum-based biomarkers as well. It's not like we're going to stop working on that. I wish we had a troponin for Alzheimer's. That would be fantastic, right? Think of it if we had a troponin for Alzheimer's, just for a second. We will have a biomarker that will tell us that, this person is going to get this disease. Boom. We can have so many therapies, test it fast and move on. We don't have that. We need new forms of digital biomarkers. We can't get to it because it is such a complex disorder. And therefore, we have to move the needle from multi-modality, diagnosis. We need to start to actually have, imaging, genetics, and clinical test data, as all these data sources into one data lake and artificial intelligence to work on that to predict who's going to become early diagnosis. So therefore, in chronic neurology, the whole paradigm shift has been going towards multimodality, in which we are looking at imaging, genetic, and clinical test data as a core pathway towards creating these multimodal data lakes in which you can have early detection as far as that is concerned. So this is where we are moving towards as far as the problem is concerned, where you future neuroscientists is concerned, where to actually put these energies in. And as a matter of fact, I mean, if you talk to Dr. Inam, who has some massive work in neuro-oncology, they are actually moving towards the same pathway as well, because the more and more they can actually get to it is faster and faster in terms of early detection. And once there is early detection, then you can actually do prevention and you can do early intervention. That creates the most amount of information. I'm going to just go ahead and play this video. Just tell me if you can hear it. You guys are able to hear it?
Yes.
Okay. And then I'm going to come back to
this. Vision of stroke care, leveraging AI and telemedicine to decrease latency in stroke care. New stroke patient alert. It's 5:33 a.m. when you're notified regarding a 67-year-old male presenting with acute onset of right-sided weakness, facial droop, and aphasia. You access the patient's chart automatically, summarized by the intelligent EMR. Activate direct to CT protocol. Next, the patient is transferred to the CT scanner. An AI-enabled preliminary assessment of the CT brain scan shows no hemorrhage and automatically calculates the E-aspect score. You activate the VMed telemedicine platform, which connects you with the ER, allowing you to observe and guide the stroke responder performing the stroke scale. You review the CT scan and confirm the findings. The app now recommends CT angiography plus a perfusion scan. You decide only CT angiography is needed in this case. Within seconds of completing the exam, the app identifies a left M1 occlusion. While you focus on the exam results, the app pre-fills the TPA checklist. Given the patient's status, you recommend thrombolysis. The algorithm aids you by calculating the patient's weight and notifying the attended ER physician and nurses. In the meantime, a HIPAA-compliant secure chat with the ER physician and vascular neurologist facilitates the swift transfer of the patient to a comprehensive stroke center via Flight for Life. The app now prompts you to contact the neurointerventionalist on call and simultaneously calculates the odds of a successful outcome. It's now time to touch base with the family and communicate these odds during the risk and benefit discussion. Then it's over to the neurointerventionalist suite, who successfully removes the clot from the vessel. The app automatically alerts you when TICI 3 is achieved. Then initiates a three-way conference call between yourself, the neurointerventionalist, and neurointensivist to clarify a post-procedure care plan, and updates the patient's family, directing them to the neurocritical care unit, where the patient is hospitalized. Neurologist updating primary care physician on patient status and prognosis. 3 months later, and the patient has made an excellent recovery. During a follow-up clinic visit, the patient informs you he's moving to another state. You locate a vascular neurologist near the patient's future home and securely transfer the patient's medical records to them using secure blockchain technology. Furthermore, the app schedules a call with the accepting physician to discuss the patient's transition, ensuring continuity of care.
Now, this is the key thing that I wanted to bring to you as far as the importance is concerned. Now, so the role of artificial intelligence in Telestroke, again, I have 3 different videos on YouTube where I discuss automated intracerebral hemorrhage, automated CTA, a large vessel occlusion. We're going to talk about CT perfusion. There's another one coming on natural language processing in terms of data gathering of text from the electronic health records, how we can automate, basically both extraction of data in terms of summarize, if the patient is on anticoagulation or not. And then secondly, also input data, faster automatic fashion in terms of etiology of stroke is concerned. And then moving forward in terms of what we call contextually aware communication, because that is one of the key issues, et cetera, et cetera. So I think that portions we're going to continue to cover as we move along, because each aspect has its own massive intricacies into it. But 3 things that I want you to take away from them. Always concentrate on convergence of technologies as we move forward. Be open to collaboration, because we are looking at not one person solving these complex issues. You need an artificial engineer potentially, you need a genomics expert, you need a imaging expert. We are looking at levels of collaboration that we have never heard of before. And these complex problems, especially in neurosciences, has to be solved by that. And lastly, and to be honest with you, most importantly, have developed fantastic communication skills, because it doesn't matter what you say, it's how you say it. So it's very, very important that you develop fantastic communication skills, and I work on it. I mean, I could have just written the paper, and the reason I developed this, animation is just make it easier for people to actually see that and summarize it. But at the end of the day, it's extremely important that you develop fantastic levels of communication skills, because that's going to help you better collaborate as well. So for young neuroscientists, it was extremely grateful that you gave me this time, and I'm very, hopefully I'm on time for 45 minutes as well. So thank you so much for this opportunity. again, that artificial intelligence, the vision has multiple things that are not currently available. Parts of it are available, parts of it I am working on, and parts of it are different industry partners are working on, FYI. So I'm just going to open it up for, hopefully this was good enough, sir, for you, Dr. Anam.
This was fantastic. Professor Zafar Bashir is gonna say something. Yes, yes, Zafar.
Junaid, so thank you very much indeed for that talk. It's absolutely incredible. A real overview of the kind of things that you're thinking about. Probably very few of us on this call actually have thought about at all, to any extent anyway. So you've really hopefully opened our eyes to a whole field that's out there, especially for some of these younger participants in this call, some of the younger up-and-coming neurologists who are thinking about their future and where their future lies. And the potential, I think, one of the things that really impressed me was the potential of bringing together the actual clinical practice, which you are currently doing, with ways of thinking about how to change clinical practice as well. Because what I guess, I'm not a clinician, so I don't have any experience of dealing with patients, but what I do see with people around me who are clinicians is that oftentimes they are very much just focused on their clinical work, which is fantastic. But how do things move forward? How do things develop? How do things progress? And I think you've opened, hopefully, our eyes, especially the people here who are going to become clinicians, who are going to become neurologists, open their eyes to thinking about, well, what else is there that can be done other than just the critical care, which is obviously very, very important. How can we develop that care? How can we bring in new technologies, the kind of things that you're trying to do here? So I think that was absolutely a real tour de force. Thank you very much indeed for getting us to think about some of these issues, thinking about technology and how technology can impact, definitely will impact. So it's going to impact on healthcare, especially neurology healthcare, but how can some of the people here start thinking about it now while it's still fresh and while they can still get in at this early stage? I think that's probably very, very important as well, because these things are happening already. And it's a case of thinking about them early so you can get in early. And it looks like we've got somebody here in Junaid who is really up there at the forefront. So if there are any questions that people have for Junaid right now, then I'm sure he'd be more than happy to answer those. But also this is a really important contact as well that you guys have now with Junaid, that if in the future there are things that you're thinking, oh, I wonder if I could think about this, or I wonder if this could work. And we've got somebody here in Junaid who hopefully will be open to you contacting him in the future as well about any thoughts that you might have about AI, technology, and how that impacts on clinical care. So that's fantastic from my perspective. I'm going to stop there because we've got a hand up, which is Rabit. So Rabit, would you like to ask a question?